Today we are going to talk about early childhood caries. We will discuss their causes, signs and symptoms, the effect they have on permanent teeth, the prevention, and finally, the treatment. Dental caries is one of the most common infectious diseases in the world. It affects people of all age, gender, and race. One group that is often affected by this disease is children. Early childhood caries is the presence of one or more decayed, missing, or filled surfaces in any primary tooth of a child up to 71 months of age. Early childhood caries, also referred to as baby bottle tooth decay, happens when sugars cling to a child's teeth for a long period of time. Bacteria in the mouth, such as mutants, streptococcus, and lactobacillus, live off of these sugars and produce acids which will eventually cause decay on the teeth. Children are at risk if their parents dip their pacifier in sugar or syrup, and if they are allowed to go to sleep with a bottle filled with a sugary drink. It is particularly harmful to give a child sugary drinks at bedtime because the flow of saliva decreases during sleep. Saliva has protective factors, so when it is decreased, caries are more likely to occur. Parents do not realize that they could be harming their child's teeth by giving them milk, juices, and sugary snacks. And other times, the parents know that the sugar is harmful, but do not think it is important to take care of primary teeth. Primary teeth, more commonly known as baby teeth, are often seen as unimportant since they will eventually be lost and replaced. However, this belief is far from the truth. Because primary teeth play such an important role, parents need to be able to recognize the signs and symptoms of caries. White spots on the teeth indicate the loss of essential minerals in the enamel. Indications of caries also include visible holes, sensitivity, pain, or a toothache. The best way to avoid early childhood caries is to prevent them from happening in the first place. Losing a baby tooth too early due to decay not only makes chewing and correct pronunciation more difficult, it also causes a loss of space. This loss of space can lead to an unnatural alignment or overcrowding of adult teeth, which can result in a child's severe loss of self-esteem and costly orthodontic treatment in their future. Unrestricted at-will nocturnal breastfeeding after the eruption of the child's first tooth can lead to an increased risk of caries. Drinking from a cup by a child's first birthday should be encouraged. Proper oral hygiene practices are definitely one of the most efficient ways to prevent the occurrence of caries. It is important to begin encouraging good hygiene habits when children are very young.
So since she already has signs of early caries, how would you suggest preventing more caries from happening? And I also have a 3-month-old. Do you have any suggestions for preventing caries in her?
Absolutely. The first thing I would start out with is don't send your children to bed with a bottle. If they have to have a bottle to fall asleep, definitely choose water. Don't choose milk, formula, juice, or anything sugary like that. Anything sugary is just going to enhance the caries process. If you're breastfeeding, don't breastfeed your child to sleep. That's also going to enhance the caries process. Try brushing their teeth 2 times daily at minimum. Use an age-appropriate toothbrush and toothpaste fluoride. Also, don't let them walk around with a bottle as a pacifier. That can really cause problems with their teeth. And also, do your best to introduce flossing at an early age. That way, as they get older, it becomes a normal thing for them, and it's not as tedious to get them to do it.
If preventative measures were not taken and your child does have caries present on their teeth, professional treatment will be needed to remove infection and restore tooth function. Treatments include fillings, stainless steel crowns, or even extractions. Like it was said before though, the best treatment is to prevent caries from developing. If you follow the guidelines we provided, you can avoid childhood caries in your loved ones. To recap what you have just heard today, we have gone over the causes, signs and symptoms, effects on the permanent teeth, prevention, and the treatment of early childhood caries. The causes of early childhood caries include sugary drinks and snacks, the nighttime use of a juice-filled bottle, a sugar-coated pacifier, and the lack of daily oral hygiene. The effects on the permanent teeth include overcrowding, low self-esteem, and the expense of orthodontic treatment. Early childhood caries can be prevented by avoiding the use of a bottle before bed, encouraging the use of a cup by 12 months of age, limiting juices to less than 6 ounces a day, brushing at least 2 times a day, fluoride, early flossing, and visiting the dentist. If these steps have not already been taken, the following treatment can be provided by the dentist. These treatments include fillings, stainless steel crowns, and extractions of the teeth. We want to avoid the expensive and painful treatments as much as possible. In order to do that, parents must understand the importance of primary teeth and how to help their children take care of them. If your kid is accustomed to drinking large amounts of sugary drinks a day, start by diluting the juice with water and slowly push them towards drinking mainly water. Do not wait until they are older and already have caries to try to teach them how to care for their teeth. Take this information to heart and teach your kids good oral hygiene habits now so that they can have that beautiful smile you want them to have. Together, you and your child can prevent early childhood caries from occurring in your family.